Hello, I'm Andrew Vallance-Owen. I trained as a surgeon, but left clinical practice at the end of the 80s, pursuing thereafter a rather varied career in healthcare, and developing in passing a passion for clinical outcomes, the importance of collecting clinical outcomes. Obviously process is very important, and we collect a lot of process measures, but actually outcome is what we're all here for, to try and help our patients get more physically healthy, more mentally healthy, and have a good quality of life. And we have always been collecting the final outcome, if you like, mortality statistics, but actually, and you learn an awful lot from mortality statistics and mortality and death rates, unexpected deaths of course, particularly in the National Health Service. But actually, of all the 8.7 million discharges in the NHS in 2014-15, only 3.3% actually died. And the question I think that one tries to answer with the routine collection of patient-reported outcome is what happens to the 97% that don't die? What happens to their health? What happens to their quality of life? It was after a particularly serious adverse incident when I was working as a Chief Medical Officer of Bupa in the 90s that I decided we needed to start collecting patient-reported outcomes. And we did that routinely across all the 35 Bupa hospitals. And in the end, it was successful. And it led in a way with an academic exercise done by Professor Nick Black to the National Health Service PROMs programme, which started in about 2007. And as you may know, the patient-reported outcomes are mandated. The forms are offered to patients having hip replacement, knee replacement, hernia repair and varicose vein surgery. And the data has been collected in its thousands, and it is very interesting and very useful. But I really think that we need to extend that programme now. It's been piloted, it's shown it's successful, and we should extend it across to other specialties in the National Health Service, and particularly to long-term conditions where there's a real need to learn about how patients are doing over time. And the benefit this brings is particularly in driving total quality improvement. It helps with the feedback given on websites, etc., to help patients make informed choices. And actually, it also encourages appropriate, cost-effective care. So I hope this talk may have stimulated some interest in this area. Thanks to Medicine Watch, peer-to-peer shared learning for giving me the opportunity. Thank you.